Spring is in the air, but that's not the only thing in the air. And for some people, the arrival of spring isn't so fresh, because along with the warmer weather and all those blooming flowers, something else has arrived. Seasonal allergies. Sorry.
An allergy is a body's unusual response to a substance that naturally occurs. The early part of spring allergies are tree allergies, and as we get a little further in towards the middle of May, we have the grass allergies. These can be very severe for patients, the tree and the grass allergies. Patients can be fine one day, and the minute the pollen starts that first day, we're inundated with 50 or 60 calls in the office because people's eyes blow up, the nose is running, they start coughing. So it happens pretty suddenly.
Pollen, tiny grains released by flowering plants that allow them to reproduce as they get picked up and carried off by birds or insects or those nice spring breezes. Because different kinds of plants reproduce at different times of the year, pollen is only around during certain seasons, hence the term seasonal allergies. So what happens when these floating pollens, while just looking for a nice plant to call home, find a person instead?
What happens is that there's an immune response that occurs when the body sees whatever allergen it is. And people who don't have allergies have more of a protective response. They have basically an inflammatory response, which is a good thing. It stops people from actually having any problems with it. They don't see it as something dangerous or problematic. People with allergies have an over-exaggerated response and produce a lot of secretions, a lot of certain allergic cells called eosinophils, which release chemicals which cause people to have the runny, drippy, sneezy symptoms that they get. It's almost like people are worried that their immune system is not working well, and in fact, it's actually working terrifically. It's recognizing something as foreign, and they have an exaggerated response to it.
Allergies are the worst right where the pollen lands, along your respiratory tract, causing the runny nose, the sneezing, and the sinus congestion, and in your eyes, which can get incredibly red and itchy. It's all a result of a thing called histamine, a chemical those eosinophils are releasing in response to the pollen. So everything seems to come back to a hyperactive immune response and a snotty attempt to wash things out. What can you do?
So I have my patients who have spring allergies come in March, and we go over ways environmentally to control it. Without even taking medications, the first thing you do is make sure your windows are closed. Make sure you shower every night to get the pollen off your hair and off your body. Make sure that you wear sunglasses when you go outside so it protects you from putting your fingers in the eye and also prevents the pollen from hitting your eye. And then there are medicines we use as rescue. Those are the patient medications that everyone's familiar with, the antihistamines you can buy over the counter. And everyone says, oh, I take an antihistamine for my allergies. Those are things that are really meant for a quick fix. They're not really a preventive medication.
Some preventative medications you can look into include eye drops, nasal sprays, and nasal steroids. These will help you clear out the sinuses and any pollen hiding away and calm down that hyperactive immune response. Then you can go back to stopping to smell the roses without stopping to blow your nose afterwards. I'm Dr. Keller-Wortham, and you're watching the eHealth Network. Get another Kleenex. Thanks.